Pirani Scoring for CTEV. Pirani scoring was given by Dr. Shafiq Pirani. It is useful to assess the severity of clubfoot at initial presentation. It is also useful for monitoring of patient's progress and deciding the timing of Achilles tenotomy. The Pirani scoring uses 6 signs, which are 3 midfoot signs and 3 hindfoot signs. The midfoot signs are medial crease, curved lateral border, and lateral head of talus or talar head coverage. The hindfoot signs are posterior crease, empty heel sign, and rigid equinus. Each sign is scored as 0, 0.5, or 1 with a total score of 0 to 6. The midfoot signs and the hindfoot signs can also be scored separately as 0 to 3. Coming to the midfoot signs. These are medial crease, curved lateral border, and lateral head of talus or talar head coverage. For assessing the medial crease, we gently correct the foot and look for the creases on the medial side of the foot. If there are several fine creases, it is scored as 0. If there are 2 or 3 moderate creases, it is scored as 0.5, and a single deep crease is scored as 1. For curved lateral border, we observe from the plantar aspect with the foot relaxed. A pin or ruler is held against the lateral aspect to look for any deviation apart from the phalanges. So you look for deviation up to the metacarpophalangeal joint. If the lateral border is straight, it is 0. If it deviates at the level of the metatarsal, it is scored as 0.5. And if it deviates at the level of the calcaneocuboid joint, it is scored as 1. For lateral head of talus, we palpate the head of talus with the foot first uncorrected, and then we gently correct the foot. If the head completely sinks under the navicular, it is scored as 0. If it partially sinks, it is scored as 0.5, and if it remains fixed, it is scored as 1. Coming to the hindfoot signs. There are 3 hindfoot signs: the posterior crease, the empty heel, and rigid equinus. For posterior crease, gently correct the plantar flexion and look for creases on the posterior aspect of the foot. Several fine creases is scored as 0, 2 to 3 moderate creases are scored as 0.5, and a single deep crease is scored as 1. For empty heel, hold the foot in mild correction and palpate with index finger and assess the amount of flesh between the index finger and calcaneum. If the calcaneum is easy to palpate, it's 0. If you can just palpate, it is 0.5. And if you are unable to palpate, it is 1. For rigid equinus, correct plantar flexion with knee straight. If you can dorsiflex beyond plantigrade, it is 0. If you can reach plantigrade, it is 0.5. And if you are not able to reach plantigrade, it is 1. You may be also asked what is the indication of Achilles tenotomy using the Pirani score. So, a midfoot score of less than 0.5 and a hindfoot score of more than 1 forms an indication for Achilles tenotomy. So friends, this was a discussion on the Pirani scoring used for CTEV. If you like these videos, please hit the like button and subscribe to the channel for further videos. Also, suggest in the comment section regarding the topics you will like to be covered in the future videos. Thank you.